Hi guys, and welcome back to my channel. Welcome back to the Mentorship Corner. My name is Sibiano Mtandazo. If you are new to my channel, welcome. Don't forget to like, to share, and of course to subscribe if you haven't already done so. On today's video, I am going to be talking on about a bit of a sensitive subject, something that some people don't even want to talk about. I'm going to be talking about mental illness. Okay, so I will not be dissecting it that deeply. I am just going to be highlighting why it's important to be aware if you have a mental illness, why it's important to seek help, the most common mental illnesses, and basically, yeah, just general discussion around mental illness. So first, let's define what a mental illness is. So a mental illness is an illness or condition that affects your mood, your thinking, and your behavior as a person. So this can contribute to your mood swings, your maybe reduced attention span. It could be anything really, but as long as it's going to be an illness that affects your mood, your behavior, and your thinking, your ability to think, basically. So the one thing I want to say before I start discussing the types of mental illnesses that are there available is that being mentally ill doesn't mean that you're dying. It just means that you are, it's almost like you have a bit of a, I don't want to say disability, but you have a bit of like an abnormality in your brain. I'm trying to find the right words. It just means you have a condition that deprives you of functioning to your fullest ability, but that doesn't mean you're not normal. One, that doesn't mean you are not important. That doesn't mean now you're not a person just because you have a mental illness. It just means you have that mental illness that affects you to a certain extent or at a certain level of your life. So basically, I'm going to repeat, I'm just going to read the whole phrase again. Being mentally ill doesn't mean you are dying. With the right assistance, you can be cured and or helped to manage your condition a little bit better. And then I'm just going to run through the top mental illnesses or mental disorders that you find. The first one is clinical depression. So basically what clinical depression means, it's a mental health disorder characterized by a persistently depressed mood or loss of interest in activities, causing significant impairment in daily life. So these people, you will find that they will normally want to be alone. They won't want to try new things. They won't want to, go out and explore because they just feel like the world is against them. The second one is anxiety disorder. This is a mental health disorder characterized by feelings of mental of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. So that's anxiety disorder. The next one is bipolar disorder. This disorder is associated with episodes of mood swings ranging from depressive lows to manic highs. That's when you've got bipolar. And then we have dementia. Dementia is a group of thinking and social symptoms that interferes with daily functioning. And then the next one is your ADHD, which is also known as your attention deficit or hyperactivity disorder. So this one is basically a chronic condition including affecting attention difficulty, hyperactivity. No. Let me read that again. It's a chronic condition including attention difficulty, hyperactivity, and impulsiveness. The next one is schizophrenia, which is a disorder that affects a person's ability to think, feel, and behave clearly. So normally when someone has got schizophrenia, they normally think, normal people normally think that person is like going crazy or something, but that's just a disorder that they have. It's not something that they can control, basically. And then we've got OCD, so that's obsessive compulsive disorder. That is excessive thoughts, which are obsessions that lead to repetitive behavior, which are compulsions, basically. And then you have got autism. Autism is a serious developmental disorder that impairs the ability to communicate and interact. Autism is normally picked up at a very young age. We normally see it in kids. Basically, if you are a pediatric health practitioner, or if you're seeing kids, please just look out for autism and make sure they are picked up at an early age so that they can be managed and treated accordingly. The next one is PTSD with age, which stands for post-traumatic stress disorder. This one is a disorder characterized by failure to recover after experiencing or witnessing a terrifying event. So this could be as a result of a loss of a family member, could be as a result of, maybe let's say you were involved in a car accident and you basically maybe lost a limb, or you lost functionality of a part of your body. Some patients undergo PTSD because of those traumas and those events in their lives. So guys, I am not a mental health or mental wellness expert. I'm not an expert in that field, but I'm just bringing up the topic as an awareness. Be aware, and basically it's also try and get the stigma out of the mental healthness topic. Just because someone has a mental health illness doesn't mean, as I said before, they're not normal. Fine, they may not be functioning like that of a normal person, but that doesn't mean you must then treat them as if they're crazy. Doesn't mean you must treat them as if they can't think for themselves. Doesn't mean you must then treat them as if they can't do things for themselves. Obviously you want to treat them with caution, but allow them to live, allow them to be themselves, allow them to be comfortable with doing stuff, allow them to know that even though they need to depend on you, but they can depend on themselves. Because proper management, proper assessment, and early diagnosis can lead to them actually living a normal functional life, and most of them do live a normal functional life. So for today's video, it's just basically saying, guys, everyone who is undergoing through stuff or any mental illness problem, you are not alone. I may not have a mental illness, and I may not know what it's like to have a mental illness, but I do know people who are close to my heart who undergo the same things, and I know that all they need is just that support from you on the side, and just for them to know that you've got them, you've got their back. And basically, as I said, don't suffocate them. Allow them to live, allow them to be happy and be merry. And you guys are not alone. Seek help, management. There's a lot of institutions that actually support and actually help people with different mental illnesses. Get support, take your medication if your doctor or your psychiatrist prescribes medication for you. If you are prescribed sessions, therapy sessions, attend your therapy sessions. Those are very important. Take care of yourself and be aware of your condition. That's the message I'm sending out today. I love you guys a lot, as always. Don't forget to like, share, and to subscribe. And yeah, that's it for today's video. Bye guys.